So what we've been doing is isolating the CLL cells from patients during their treatment course, and then looking at epigenetic marks, so looking at marks associated with active transcription as well as repression, and how these change over the course of the treatment, and whether or not we can use this as a tool for predicting if a patient would relapse, or just looking at whether or not we can use this as a tool for predicting outcome of the drug treatment, and just seeing what's actually going on, because nobody's really looked at this before. We've got a few hypotheses, as we always do. So we found that one of our active marks we lose completely during treatment, whereas one of them actually remains stable throughout. Our repressive mark, which represses transcription, we actually lose as well. So this suggests that actually the cells go into a dormant phase, so that they could be reactivated with another signal, which would be a relapse for a patient, which is obviously not what we want. So we're going to track these changes in the later time points, so later treatment points as well, and see if whether or not we can see any patterns occurring, or if it's cells seem to be more lean towards more one activation pathway than another, and whether or not this is actually relapse or it's just the cells reprogramming. Then it'll be a case of how to make this high throughput, because it's sequencing, so it's a lot of money and it's a lot of work to do. So it would be a case of sequencing numerous patients from the trials, saying, right, this is always changing, and this is consistent, and this results in relapse. And then you could do something on a lower scale and then develop it into a high throughput method. We've only been studying the first 56 days of treatment, so for us it'll be moving on to the later time points to see what's happening to our the marks we look at and how they're changing. Also to look at patients who relapse from Ibrutinib treatment and how the epigenetic landscape changes. Also to look at other trials, so look at iwCLL, which blocks the PI3 kinase, and see how, compared to Ibrutinib, how the landscapes are different, as well as looking at venetoclax, which is a BCL2 inhibitor, and again looking at how the epigenetic landscapes are changing. Is there any similarities between them, or are they completely different?